Hi everyone, my name is Mirabel. Thank you so much for joining me today for a few minutes to talk on the topic of decentralization in healthcare services. I want to spend a few minutes to just explain what decentralization actually means, why it matters to us as an organization that operates in this system, and how it will affect the way we deliver care to the people that we provide care to every day. What is decentralization? Decentralization in healthcare simply means the decision making power, the resources and the responsibilities are spread across multiple local entities rather than having them being controlled by a central authority. Instead of one large system making these decisions, different hospitals, clinics, public health units, and community organizations each have the authority to plan their own services, allocate their own resources, and respond to the challenges of the local community they are providing care for. Why would a community choose decentralized healthcare? Communities will often decide to adopt this kind of care for a few reasons, or should I say several reasons, which I'll list a few on this video. They want to have it offers them an opportunity for local control. Leaders who understand the community they are serving, they understand the needs that the community has, and they can easily make decisions faster to meet these needs. It also provides access. They can improve access for the community that they are serving, because since they know the needs, they can decide, okay, this is what my community needs, and they will make those resources available, making it accessible for the community. So it improves access. It also gives room for innovation. Smaller units or smaller groups can easily experiment on new healthcare models without having to wait for the big authorities to approve, or the bigger system to approve that experimentation. It provides accountability. Patients and the community members, they can easily engage in local decision making when they know that the people that decide or the people that offer our services are right here, instead of thinking they have to wait for the bigger offices to decide what they're going to do, how they're going to do things. In short, decentralization aims to bring healthcare closer to the people it serves. How does decentralization affect us as an organization? For us, as a department, decentralization shapes our daily operations in several ways. Some of the ways include coordination, which is very, very essential. We are working now with, we're not carrying everything on us. We have different systems that are operating, right? And sometimes the cares that we provide are not exactly the same cares that the other systems providing. So if we do not organize, we're going to get things all mixed up. We need to organize. Communication is one of the biggest things here. We need to stay in clear communication with other systems to ensure that patient care is not discontinuous. Patient care remains continuous from one system to the other. That is one of our responsibilities as an organization. Another one is flexibility. We know that things change and things can change pretty quickly. As an organization, we are expected to adapt to these changes and continue to provide care to the community that we serve. It also shares responsibility. Like I said earlier, we are not carrying everything by ourselves. We have other systems that are operating in together with us to ensure patient care. So it shares opportunities, it shares responsibilities, excuse me, and it also provides opportunity for leadership. It's not like one big office is sitting there making decisions, testing things, and deciding, oh, we want to try this, we want to experiment on this. But we have these smaller systems, including our system, that is also operating in that way. So it gives you opportunity to innovate, to design things, to practice things, to test things, and then decide what works for you. One thing that I want to say before I end this talk is the effects. There are challenges that come with decentralization. It is imperfect, it can bring variation in service quality. Different units will provide different cares at different quality. There may be challenge with resource distribution where it is uneven. Some underserved communities might receive more resources. There might be confusion, especially for patients who are receiving care in different systems, and occasionally you might have duplication of services. Please, if you are interested in learning more about this topic, I will recommend that you read the article Decentralization and Health System Performance, a review of the evidence published in the Health Policy and Planning. It provides an excellent overview on this topic. Thank you for your time again. If you have any questions, my door is open. Come in and let's talk about it.